Hello everyone, this is Dr. Mohib and today we will be discussing about acne vulgaris. Alright, so I guess this is one chapter in dermatology, right? Either per se one topic in dermatology. I guess this is the most famous one, and I don't think so I need to discuss about it because I guess we have extensive knowledge about it already, right? Even though before reading it, because I'm pretty sure that most of us has gone through some sort of abuse by this bacteria, right? The Propionibacterium acne, right? We definitely had this definitely in our late teenage years, right? That was when it happened, right? The whole mayhem. Okay, but yes, as the age grows, right, as we grow older, these things tend to subside, but not for the one who have maybe probably oily skin, or they have a lot of consumption of milk products, yes, or any milk derivatives. Yes, so let us just start with it. I think it's going to be very interesting session for you and me as well. All right, so let us begin. So one of the most common thing, right, where is the insult actually happening, right? Definitely there is sebaceous gland that is happening, right, and in the hair follicle, right? Inflammation of the hair follicle is where the actual infection is starting up. Okay, inflammation of hair follicle. All right, and the sebaceous gland. Okay, all right, these are the two things, right, which get affected, and that is the reason we have complete pus formation, right? The whole hair follicle is affected, and then eventually we would have a scar in the later end as well. Okay, everything we'll be discussing here today. And which is the most common organism that is related to acne vulgaris? That is a Propionibacterium acnes. Okay, all right, we have the Propionibacterium. Alright, that is the one who is affecting and causing the whole mayhem, right? What do you think could be more risk factors, or per se something which can cause the acne vulgaris? Okay, what is the most common cause? Is the one we did just now, right? And adolescence. Yes, so we have why adolescence? Because definitely there is an imbalance between the hormones. Alright, definitely per se that is the androgens. Okay, that is the one which causes the acne. Yes. And definitely why am I telling androgens is you might have seen whenever the professional bodybuilders, they undergo all this steroid abuse which is there. All right, so definitely they have these androgens in it. Testosterone, they use it in a very high level, and all the anabolic steroids which are there, they usually you see on their back they will have this acne, right? And they will have acne at a very unusual presentation, right? Probably in the at the forearm region or the shoulder region. Yes, they would have it at a very odd location where we usually don't have it. Okay, just an example for that. For what? For presence of androgen. Okay, all right, how about the next one? It could be because of what? The skin, right? We have the pores. Yes, we have the pores, and the pores, they open and they close at a set temperatures. Okay, fine. The warm water will open, cold water will close it. Okay, but if there is obstruction of these pores, right, because of any XYZ reason, yes, what is happening is, because of obstruction, there is infection in the hair follicle. Okay, all right, that is one of the very key reason. Obstruction of, okay, by, it could be any personal products. Yes, usually if for example, just example, okay, if somebody is having an oily skin, okay, and the person is applying a very thick moisturizer, what do you think is going to happen? The person already has an oily skin, he's applying a very thick layer of moisturizer. Maybe he doesn't have knowledge, or he just not bothered about these things. He will have acne in very less time. He will have acne because the hair follicles and everything is blocked, and soon, probably in a day or two, he might have a few outbreaks. All right, so that is one thing we have to remember about. Okay, this one point we discussed already, that as the age increases, presentation, that the outbreaks decrease. Yes, but at some given instance they would increase is when applying corticosteroid creams, or any cases where there is increase in the androgen level. Okay, that is two. These are the two conditions that we have to remember. Increase in the androgen levels, these are the most related to misbalance in the hormonal level. Okay, and androgens. Okay, that can cause outbreak. Okay, fine. So acne, where do we usually have acne? Yes, we would have it on our face, obviously. Yes, at our back, back acne, which is very prevalent, okay, and definitely could be on the neck. It can have on the chest area as well, right? So back and face are the most common areas, right, affected by this acne, okay. Definitely they have scarring, and in post-inflammatory, what do they usually have? They heal with scar. Definitely we'll have a scar, at all the places that there were acne, there will be scars now. But sometimes they heal with hyperpigmentation, okay. Now that is the thing, the whole mayhem causes. Okay, fine, there was some, even like just, it started with just affecting a hair follicle, right? But eventually you see, it ended up having hyperpigmentation. Alright, fine. They can also occur. So let us just go see the presentation over here. What is usually happening? This is normal follicle, right? And over here you see, this is the whitehead. Yes, whitehead comedone. Over here you see all these bacteria which are there, which will infect it. Over here you see, this is the blackhead. This turns into a papule, yes, pustule, and they end at the later and they form a cyst. You see, but sometimes you see the hair is here all the time. Sometimes even the hair is uprooted. Then there is a problem. Okay, you see over here, this is the hair, and this is the normal one right over. You see, this is the cystic presentation, right, of a single hair follicle. Okay, all right. Which acne is this? Which type of acne is this? It is a nodulocystic acne. I should write it. Alright, the most severe form of acne is nodulocystic acne. Okay, alright, you can see this acne vulgaris. This is acne vulgaris. This is the most common presentation of acne. Alright, so now we had just a bit of information about like how it looks, what are the little bit of presentation. Now let us see. Now let us just continue about the treatment aspect of it. So I guess we don't need to even discuss the treatment. Yes, why? Because we usually know these things so much. We have most of us who are watching the video, they might have used some sort of medication already, right? That is being discussed. That will be discussed eventually. And also we'll be discussing few tips regarding the skin, right? What can we do about the skin and everything. But let us just discuss that right now. So one main thing that we have to take care about is our hygiene. Personal hygiene is a very key importance. Okay, fine. You see over here, we just discussed that. Okay, everything is happening because there is entry of a bacteria, the Propionibacterium acne. That is the one which is entering it. So if we just keep a proper hygiene, things would change. Definitely things would change. Hygiene in what? First of all, we should be cleaning our clothes. Yes, so we definitely not repeating clothes. If somebody has a back acne, that is one very major thing that we need to follow. Second, taking a bath 2 times a day, right? That is very important. And third, we should all the clothes that come in contact of our face, right? Definitely pillows are one thing. Yes, we need to take care about that. Secondly, whenever we get up, right, so we have to do a face wash. Yes, that is one thing. And after we're done with face wash, so we should maintain a towel, right? The towel should be a paper towel, right? We should just use and throw. So what is happening is, because of the towel, if you are just using continuously a cotton towel, for example, you just wipe out all the bacteria and you kept in that nice fresh. You think like, yes, my towel is very nice, is very good. But what is happening is, next time you use it, so you are reapplying that bacteria on your face again. Now you just, why there will be no breakouts on this? You are giving perfect culture media for the skin, culture media on your skin to grow the bacteria. Right, so we maintain the personal hygiene. That is one thing. Second thing, what we can do, we can have a very proper, clear diet. Yes, a lot of us, we tend to overeat milk products. Yes, milk products, they cause mayhem. In the whole skin lesions that we have, specifically nodulocystic acne. The most severe form of acne is being caused because of this. Yes. Some people are okay with it. Yes, I know few people they are okay with it, but a lot of majority of people, like 8 out of 10 people, they eat any milk products, they will have acne the next day or some other day. Okay, and limiting our sugar intake, that is another thing that we have to be very careful about. Yes, these things are there, but in this, 2 milk products are very essential for us. Definitely we need to have an animal source of calcium as well. That would be curd and yogurt, preferably yogurt. Yes, preferably yogurt, because if somebody is lactose intolerant, he or she cannot eat the curd, but they can eat yogurt. Okay, that is one thing we have to be very careful about. Yes, and also moreover everything, if we have an active lifestyle, for example, if you are just going for a walk, if you are just going for a run, all right, run for like just a quick run through for like 500 meters or 1 kilometers we are running, what's happening that we will sweat. It will just clear our pores. That is one thing we can be very, very, very careful about. And definitely if we are aging, yes, so we need to take care of the wrinkles, the micro wrinkles that we have, the crow's feet, that which will be clearly elicited if we are not taking good care of our skin, right? We could look 10, 20 years, 15 years older or younger, depend on what you are doing good to your skin. Yes, that is one thing. Proper hydration is one thing. Yes, we have to remember that one as well. And how to keep our skin very pristine clear, right? Only 5 to 6 drugs are there. If we can just maneuver these things, it will work in our favor. First of all, what we can do is we should apply the chemical peeling agents first thing. Okay, that is the glycolic acid. Glycolic acid is a very miraculous drug which is there. The OTC one, right, which we usually get with a very less concentration, and eventually we have to pay very high money for that. Okay, but if you guys use your brain a little bit, yes, you can get a very good option of glycolic acid at a very good rate. Glycolic acid plus urea is the best combination for the skin. Okay, but eventually we have to increase the dosage. That is one thing. The next thing is alternatingly or just using about 1 to 2 times a week retinoic acid. Retinoic acid, if been used properly, it can prolong the fine lines by 5 to 10 years. Yes, that is one thing. Having daily vitamin C, that is one thing that we have to do it. Yes, vitamin C, definitely we could use a serum and all, definitely we could use it, but having a daily intake of vitamin C could be any citrus fruit. Yes, make sure you have one snack of vitamin C. Yes, it could be oranges, it could be amla, it could be lemon, it could be any source that you like. Make sure you take a natural source, not the tablet form which is there. Okay, that is one thing we have to be very careful about. And moreover there, definitely we can just maintain a clear tone of our skin, right? The skin color which we have, right? So if we just maintain that, how could we do it? We can just follow a day routine and a night routine, right? Night routine, what we will do, we will just wash our face, step 1. Step 2, what do we do? I'm just telling on a very normal basis that everything is okay and that person can follow this, or we can just give a very rough idea about how things should go. Before sleeping, for example, you just apply probably glycolic acid. Yes, or you can just apply retinoic acid. That could be one thing that we can apply after waking up. Or you can also apply niacinamide serum. That is also very good. The next thing, after waking up, we wash our face. Yes, wash our face off, and then what we can apply? We can definitely go for a vitamin C serum, right? We should apply that, and also please make sure that we are well protected with sunscreen. Yes, and if we just do all of this, I know it could be like very intimidating, but once we get into it, the results are very miraculous. Yes, definitely there is not much that needs to be done to look good, to have a very good skin and have a very clear maintaining skin, right? All those radiating glowing skin and everything. Yes, okay, so that was a lot, right, about this. I thought like I would definitely include this part in this lecture, and yes, I did. Okay, so this is an nodulocytic acne which is there. So we go about the treatment aspect. Fine. What do we do about the treatment is first of all, first line drug are topical retinoids. Acne, first line topical retinoids. Okay, very miraculous drug these are there. These are topical retinoids. They are the first line treatment for the acne, and definitely they can be used for what do they do that actually happens? They decrease the sebaceous gland activity, right? They decrease the activity of sebaceous gland. They decrease the activity of sebaceous gland. Or they decrease the sebaceous gland activity. Second line, what can we do in second line? Yes, okay, fine. There's bacteria. We will give antibiotics. Yes, we could give oral or we could give topical antibiotics. Yes, to decrease the bacterial growth. Fine. Another second line therapy that we use is benzyl peroxide. Benzyl peroxide is the most abused agent, right? We in this, and definitely it has very good results. Use of benzyl peroxide. It has antimicrobial properties. Definitely it does. Comedolytic properties help preventing follicular obstruction. Benzyl peroxide is often used with antibiotic and a topical retinoid. Combination is being used. Okay, benzyl peroxide and the retinoic acid. In women, right, this point, yes, in women, if she is having something as a PCOS, yes, this is the reason she will have an increased androgenic level, right? So what can we do? Do we give retinoids, or do we give something called as an oral contraceptives? We would give oral contraceptives, right, so that we can control the PCOS condition, so that we can control the reason why there is increase of androgen in her body, right? We have oral contraception. Yes, they can be used as well. Alright, in severe cases, yeah, this point is very important. So in severe cases, which severe cases? This guy, the nodulocystic acne. Yes, what do we give over here is isotretinoin. Isotretinoin has to be given in this patient, because the presentation is too severe, right? So what we will give isotretinoin. But one pharmacological link over here that we need to know, like you cannot just go to the pharmacy and buy this and start taking it. Very dangerous. Oral isotretinoin. Okay, oral isotretinoin can be given to the patients. But why am I telling that it is dangerous? That the reason is it is teratogenic, hepatotoxic. Yes, when you go and buy the pamphlet, the warning sign which is there, it is like this much paper, A3 size paper they would give. Inside that, the capsule, right? The capsule which is there inside the box, you will have a paper which warnings as good as A3 size. Okay, these are the two most common side effects which are there. Okay, yes, this is teratogenic. We will write here, and this is as high hepatotoxicity. But if this is teratogenic, who will not take this? Who cannot take this is somebody who is planning pregnancy, right? So before advising, yes, this drug, so it is very important so that we take a proper consultation from the patient to find, are you planning a pregnancy, or is there anything, we have to take proper history, obstetric history, gynec history should be taken from the patient. Okay, that is one thing, because of extreme teratogenicity. And definitely we have some soaps and astringents which are there, but they are not really helpful. What is helpful is written here. All the drugs which matter in the whole course of this treatment are written here. Topical retinoids, yes, what it does is decrease sebum gland. Antibiotics are there. Benzyl peroxide, oral contraception, yes, we would give in a woman who is having hirsutism because of PCOS. Okay, that is one thing we need to remember. Isotretinoin we would give, and we have to make sure that we should make sure that we have a proper history of the patient. Okay, all right, because of the teratogenicity. So that is all about the dermatology light series. Yes, so we did discuss quite extensively. Yes, even though it was each and every topic that we discussed, it was very brief. In the detailed series, right, we have been gone more and more elaboratively and included more topics as well in it, right? I guess in this we had about 27-28 topics individually in this whole series. So I hope you guys had a good listen to it. Please forgive me if I was wrong in some aspects. I could be wrong, maybe I have spoken something wrong, or maybe I written something wrong. All right, so please forgive me with that. We both are learning, and who all viewers are there, definitely I would be excited to meet you guys at some point in the life. All right, and that would be something I would be really looking forward to, and I hope I did justice to your time. And thank you so much for watching this video, and definitely have a great time. Thank you so much.